You guys are in for a treat. We're gonna look at a throat that I hope you haven't just eaten. This one's impressive. Let's go take a look. Hello, how you doing? Not so good, I heard.
Yeah.
No.
Yeah.
So you've been sick a while. You were here at the office a few days ago, last week.
Yeah, last Tuesday.
And so this all started how?
Well, the Friday before last Tuesday, I noticed I had like the swollen lymph nodes.
Okay,
and
so
then,
10 days ago, swollen lymph nodes.
And then I started getting like tired more easily, and I
Gotcha.
get dizzy.
Tired and dizzy. And then you came in here 6 days ago, that would have been Tuesday.
Yeah.
And you had some lymph nodes here.
Yeah.
And they actually swabbed your throat.
Yeah, no
and
strep.
It wasn't strep. And they did a CBC for those who were watching. That's a complete blood count. And it kind of looked normal.
Yeah.
Not too impressive. Certainly didn't look bacterial. White count was like 4,000 something. 40 limbs, 40 neutrophils, something like that. I don't know. I didn't see the exact numbers, but pretty normal looking. Okay, what's happened since then?
Like my throat is really sore, and there's like a bunch of white stuff on my tonsils.
Bad sore throat. All right. Well, we're going to take a look. I've already peeked in her ears, and now I want you guys to take a look at this throat. So go ahead and open wide and look down a little bit, but stay open wide. Get as close as you can. So those tonsils for our viewers are about 3+. When they're touching, they're considered 4+. And the uvula, the little thing hanging down the middle, is also red. And you can see big white, yellowish white caked, what we call exudate, just sort of stuff, pus, yuck. Can you say a big ah? Yeah, that's amazing. So that, folks, is a really gnarly looking throat. Thank you for sharing that with the world.
Yeah.
You're amazing. We're gonna actually swab that again, because I'm a doubting Thomas. My last name's Thomas. Dr. Thomas is a doubting Thomas. They swabbed it and got a negative strep, but I gotta make sure. So come on close again with that camera. Say a big ah. Good job. So you just swab those tonsils. Good job. You did amazing. Did you catch that? Mm-hmm. Fantastic. All right. So I've got yuck on these things. We're going to carefully separate them because one of these is a backup, and we're going to stick the backup in there. And then this one's going to get a rapid strep test done that just takes 5-10 minutes. Boom. Got it right in the bucket. Did you see that?
Yeah.
I do that all the time. I don't. I miss all the time. But every once in a while when you get lucky, you just gotta call it. Alrighty. So I tell you what, we're gonna go run this, and then we'll be back. We'll have an answer in about 5 minutes.
Okay.
5-10 minutes. If this is not strep, viewers, do you know what this might be? Any guesses? Any guess? Any guess?
Tonsillitis.
Well, oh yeah, you were on the internet.
Yeah.
It is tonsillitis by definition. When your tonsils are inflamed like that, it's itis is inflammation, tonsillitis for sure. But if it's not strep causing a tonsillitis that bad, it's probably mono. Had you thought of that? Did you find that on your internet search?
Yeah, that was the first thing I thought.
Yeah. So it could be mono. We have a rapid mono test that can be done on the finger poke, so we might, not another one of those. We might have to come back for that. You also have another interesting finding for our viewers, and that is that your nodes, I mean, you can just see it right there. There is I don't know if you can see, but that neck is swollen. There's nodes back here, and there's a big old node right there. And when I touch, does that hurt? Yeah. So they're on both sides. This is the anterior chain. The sternocleidomastoid muscle goes from the mastoid muscle right here down to the sternum right here. If the nodes are in front of that, that's called an anterior cervical node. You got that big one and it hurts.
Yeah.
And then you got a bunch in the posterior chain behind the sternocleidomastoid muscle. You usually see a lot of posterior stuff with viral or with mono, and you tend to think if it was just here that it's more likely to be bacterial, but it can be. That's just a generalization. When it's tender, it's itis. It's inflammation, lymph, adenitis, lymph node inflamed and infected. So we're going to treat you with something.
Okay.
We just, maybe, well, I lied. If it's mono, you don't do antibiotics for mono because it's a virus, and antibiotics will actually make you worse. So we're going to figure it out, and we'll be right back for an update. Don't go away. All right. What are we up to here?
So we have a negative strep test,
Yeah?
a second one in a week, and
Huh.
so Doctor.
Was I a non-believer or something?
yeah.
Yeah, doubting Thomas.
Well, sometimes it can turn positive.
Okay.
So now we're doing a mono test.
Ooh, let's go see.
Let's go do
Let's
this.
go see. So unfortunately, the strep was negative again. I shouldn't have been a doubting Thomas. So we're gonna do a quick little mono test, okay?
Okay, here we go. 1, 2, all done.
Wait, that was different from last time. That was not the same.
And we do one little drop.
That's all?
That's all.
Seriously? Just one drop? Mm-hmm. Doesn't feel like that should be enough. Cooperate, little finger.
It's not going to. We'll shove it down with this.
That's all you needed?
Yep.
Huh.
And it mixes with a drop that's in there.
Oh, this is a rapid monospot, you guys. Isn't that cool? Rapid test.
Oh.
All right. Well, there you have it. We'll be back with the answer soon. Still smiling. No passing out this time?
No.
All right.
She's upright.
Fantastic. So, how can we tell this is positive?
So there's a blue and a pink line. The pink
Oh.
line means the test worked. The blue line means it's positive.
Look at that, folks. This one turned positive. We have an answer. You were right.
That's right.
You have mono. What do you know about that?
Nothing. Oh.
Nothing? Okay, so you have a little handout about mono that you guys can read. I'd like to stress the importance of rest.
Yeah, I haven't moved from my bed or the couch for like the
Okay.
past 3 days.
Mono is mostly passed between people who are in really close contact. If you're sharing a toothbrush, if you're kissing, those sorts of things for sure, right? Sharing oral secretions, perfect way to get mono. I'm not gonna get it sitting right next to you generally. Haven't yet. Watch, I just said that and I'll be the first time. So yeah, just don't share foods,
Yeah.
drinks, anything with anybody. You will recover so much quicker if you hydrate well,
Yep.
eat all the nutrients you can get, phytonutrients, right? If it's juice, it should be fresh squeezed. If it's, smoothies with fresh, organic vegetables, if you're just like getting all those colorful foods, right? And then just otherwise try to eat real food, not junk food.
Yeah.
And then I would take high dose vitamin C, 1,000 milligrams 2-3 times a day, if you can tolerate it. If you're not taking vitamin D, get on vitamin D. It's good for your immune system. Probably 5,000 I use a day. You could take you don't want to overdose on vitamin A, but it is good for the immune system. But just RDA, recommended daily allowance, whatever that is, just take that every day. If it says beta carotene, even better, you can take more of that. Lots of fluids, but mostly rest.
Yeah.
Are you in any sports right now?
Not right now.
When's your next sport?
Probably fall.
Okay, we got time.
Yeah.
You lucked out on your timing. I had
Yeah.
one of my kids lost a whole season of basketball with this. So really take it easy, rest. If you need to take naps,
Yeah.
right? I mean, you're just gonna really lay low. Kids who get this in school, sometimes they're out of school for a while.
Yeah.
They just don't have the energy to even go to school. That's part of mono. I mean, it's no fun.
Yeah. I
Okay.
had to skip a few days of school
Yeah,
during finals week.
bummer.
Yeah.
So if I didn't feel a spleen, so for viewers, you don't do contact sports with mono because you can sometimes have an enlarged spleen. You would be off of all possible contact sports until you recovered your energy and your spleen is back to normal. We should probably check you in a month, just do a follow-up. Sooner, of course, if you're struggling with anything. Mono is a virus, EBV, Epstein-Barr virus, that causes mono, that can infect almost anything in your body. So, I mean, you can have crazy problems with your blood work, with your liver functions, with even rare, like encephalitis, brain. I mean, it's just, so if anything new is happening, come back,
Okay.
right? But generally, follow those instructions, you should be fine. And let's see what our handy dandy formal instructions say. We'll start right here. It's a viral infection, severe sore throat, large tonsils with pus. You struck gold there, lymph nodes, right? Fever 7 to 14 days, tiredness that can last months. I've even seen it last over a year or two. Hopefully it'll just be weeks.
Yeah.
Okay? It's caused by Epstein-Barr virus, transmitted through saliva, coughing, sneezing, kissing. How long does it last? Usually 2 to 4 weeks, but like I said, I have seen it longer. I'd stay away from acetaminophen, even though this says acetaminophen. Don't do it. That's, I didn't write this, so yeah. Acetaminophen blocks glutathione, your major detox and healing molecule, so you're just better avoiding that. Lots and lots of fluids and rest. You can treat your sore throat, you can gargle with salt water, avoid citrus fruits. Citrus is gonna hurt, right? And stay in bed, rest. Got that. We talked about the spleen, nothing, no heavy lifting, no contact sports, and you're contagious while you've got the fever, but it can be in your saliva up to 6 months. So gotta be careful for a long time. Here's what to call us: severe trouble breathing, severe abdominal pain if you're feeling super sick, right? Because it can affect almost anything. And the rest doesn't quite apply except drink lots and lots of fluids. All right. Big thumbs up, you guys, for a great case. That was the best sore throat we've had in a really long time, and we ended up getting it figured out.
Yeah.
Which was nice. I mean, it's not good news for you, but you'll recover.
Yeah, hopefully.
All right. No, definitely, but just take really good care of yourself. It's important. All right. I have a videographer today who's also a naturopath, so I'm just going to double check with my videographer. Are there any other self-care things you would suggest?
You can do EHB supplement.
All right. EHB supplement. Kat, tell us about that.
Really support your immune system and wipe out a virus. EHB stands for Echinacea, Hydrastis, and Berberine, which are all just really good antiviral, antimicrobials. And to kick it, you do 3 caps 3 times a day for 3 days. And that can really help boost your immune system. And lots of steam inhalation to help with that sore throat.
Yeah.
You can do a warm compress with a towel around your neck to just about a minute to 5 minutes of a warm compress followed up with just 30 seconds of a cool towel. That alternating hot and cold with the moisture can really help reduce all that inflammation.
Perfect. Where do we get this EHB?
You can get it at Wellevate.
Well, there you go.
Yeah.
You can go to wellevate.me. So this is a website I've provided for people to get a 25% professional discount. And you can also get it at most of the big health food stores, Pharmaca, New Seasons, those kind of places, I believe. You guys, big thumbs up to our great patient. I'm on the wrong side of this camera. There's my thumb. What a weirdo. Thanks for watching. I'm Dr. Paul.